Hey everyone, it's a dose of Dr. Drew.
Hey everybody, welcome. Let's get you piled in here on the restream. I'm starting to see people come in. Come on in. I'm going to have a guest on the show in just a second. Give me a minute to get everything going here. How's everybody doing? There's that restream. Hi guys. We finally got here. That's right. Thank you guys. So let me get to my guest. And now that you guys are kind of piling in here a little bit. My guest today is from New York City. We thought we'd get one of our friends in New York to give us a firsthand account of what it's like on Manhattan Island. Cam Fruscia. Cam, are you there?
Yes. How's it going? Thanks for having me.
Oh, don't be silly. Thank you for taking a little time out to talk to the rest of the country about this thing. So what is it? How bad is it in New York? How bad is the panic? What does it look like on the streets there? Give us a little eyewitness report.
So, I grew up in kind of background. I grew up in New York, and I can't tell you, I was here from 9/11, again, 30 years old. So I've never seen anything like this. There's no one out. We try to keep our sanity and walking around, and there's businesses boarded up, signs coming down. It looks like some people are almost not even coming back to work. It seems like they almost shut their business down. The only people we really see out are construction, which is still going on.
Huh.
Even the homeless have gone away to some extent.
That guy with the TED outside your apartment, is he still there?
No, he just came back, so he's here.
Okay, good.
But it's a remarkable time. It's unlike anything I've seen before. People are just kind of walking on the streets. Occasionally, people are going out for exercise, but it's very sad, to put it in kind of one word.
Anybody else dressed like a character from Bob's Burgers except Kat?
No, that's been driving people to do anything. I mean, thanks for your time. There's really not much else they can do. I think our highlight of our day is kind of going for a walk
with Pink Bunny or hoodie.
Yes.
Okay, well, it's a creative time. But you actually overlook the Javits Center, and that's going to be a 1,000-bed hospital any minute now. Are you seeing much activity over there?
So I'm glad you brought that up. So yeah, we're right by the Javits Center. So this is like ground zero, kind of where most of the medical aid, or one of the few facilities that the governor has laid out in New York to be an extra kind of hospital, and makes sense. I mean, it's a significant amount of space in there. But I would say about maybe like 4 days ago, we started seeing some National Guard troops come out of there, and we knew something was happening. And then they announced it, and kind of slowly been happening. But we had some tractor trailers about 2 days ago coming in there, about 4 or 5 of them, white ones, unmarked. Assume they're bringing supplies to set it up in there.
Right.
And there's just been
Cuomo's been doing his daily press conferences out of there, it looked like to me. No?
Yes, he was there. He was there the other day. I don't know if he's back in Albany or he's down here. But it was the other day when it was raining. But there's 5 to 10 news trucks outside with their tents just waiting over there. But yeah, it's a lot of activity kind of around that area. But prior to that, there was no one near the building, as most large meeting areas have been shut down.
It seems to me that I've decided that the big problem is the elevator. Everyone needs to start taking the stairs, because elevators are just like boxes for quarantining, for capturing the virus. You know what I mean? And no one gave any thought to that. I mean, if you get in an elevator, man, wear a mask, at least on the elevators.
I even think too. Okay, so there's only a few places you can go, from grocery to pharmacy, that are kind of open, and liquor stores are essential. But even your credit card, I would say the credit card holders, or your sign, stuff like that.
That's right.
Touched by a lot of people.
Yep.
And they haven't figured out a solution to do that. And I'm always, come home, wash my hands. I'm really conscious of it now. But when you go out, like, I hate touching that thing, and I wish they could do something that you're not, doing that. Or even your credit card, swiping through that, someone touched that, and then you're putting your credit card back in. I don't know why they don't have hand sanitizer outside those, especially facilities like that. It should become almost mandated.
Now, one of the things I just saw, now I don't know much about this story because it just came up on Twitter, that Governor Cuomo was preventing pharmacists from prescribing or from filling prescriptions for hydroxychloroquine, which, again, there's a lot of enthusiasm for that around the country amongst physicians. Is he wanting to build up the supply before he releases it? Is he talking about that at all? Do you know what's going on with that?
I'm not that familiar what his intentions with it. I mean, I think some of it is. I mean, I hate today in the political environment, at least I think we're in, that anything the president says, someone's going to have some adversary to it.
Mm-hmm.
Some people that are staunch upon with him coming out saying that, hey, this could be a proof. You saw the guy who used was it fish cleaner or something, had some of it in there. You have people do some dumb things. I think the FDA hasn't approved it. But people want medication fast, but we've seen results in other parts of the country that's done well, and a few that haven't. Right. I mean, a lot of times the news highlights things, especially when it has gone wrong or like the extreme cases.
Yeah.
But I'm not sure what he's trying to build up. The one thing I will say we have seen, because Kat takes vitamin C tablets, and those are all sold out at the facility. And an article came out saying that that's been they've used it in China. It's actually slowed the spread. So that's one of the things you can't find anymore in the stores here.
Zinc too is another one, like 50 to 80 milligrams of zinc people have been talking about is maybe helpful too. So that's interesting. To me, I don't understand why there isn't enthusiasm. I'm going to talk to Dr. Oz tonight on my Fox 11 program. He's going to be my guest on that. And he has been speaking to the French researchers. There's all this data about extreme efficacy, or at least in terms of reducing risk of hospitalization or complication with the use of hydroxychloroquine. I just can't imagine why he would get in the way of doctors prescribing that. I mean, that could prevent the catastrophe that he's worried he's going to be dealing with.
Yeah. Well, I mean, and it just seems like I don't understand that. And every day he's coming, and it seems like it's gotten worse with the cases. I think part of it's also been we've been testing more as well too. So people are underlying here, and again, New York is a global city. It's a very transit hub, and probably a lot of people coming back from Europe and Asia kind of around the New Year's or around Christmas time when it broke out. So we probably had a lot of people with the case already, and we're just discovering that they've had it.
Well, that's the other thing,
or gotten it.
Yeah, that's the other thing is if we could figure that out. If we could do antibody testing, widespread, that would be very helpful. But they're not doing it for some reason. I don't know why.
I mean, the good thing you saw in a press conference today is that, they were talking about the risk of hospitalization. A couple of days ago, it was every 2 days it would double.
Yeah.
Now it's at 4.7, which is, fantastic with that. But it seems like things are happening here. But the other thing I'd also say, things are happening. It seems like, or at least I know a lot of people, friends with, I've seen a lot of them leave New York. Which I don't know if that's good or bad, because whether they're infected or not, but a lot of people have left the city. So let's just say this stuff does change. I don't know when people would come back, which would be a double whammy to stores if they were open up to staff and then take a loss because they're not earning the typical revenue, which I think is something that we also need to think about.
And you sort of are in the world of finance. What do you imagine? To me, like you're beginning to think about the harder part about this whole thing is how do you ramp things back up again without creating another outbreak? Do you have any thoughts about that?
I mean, how do you get people to not fear something or feel like it's gone away? That's a psychological thing. That might be more.
But I'm wondering. Well. I'm thinking more about do we do
you incentivize, right? I mean, I think there's incentive. Like you incentivize over price to some extent. That gets people to move. That's how you do it typically and stuff. But the fear of disease or infection might outweigh that, honestly, at any price point right now for most people. But there is a price that will make people move at all things. So that's kind of I think that's the way you bring it out, whether to some extent. But the media's got to help out as well too. New York has a below 1% death rate, which is unbelievable. If you see some of the death rates around the world, I think China's at 4%. Some of them are over like 9%.
Right.
So we're doing something right here, and you're coming close to flu levels of death. So,
right. That's something I've been saying from the beginning is that watch the U.S. healthcare system and what it can do. This is what it can take care of business. I'm not surprised to see the death rate going below 1%. I am surprised to hear the hospitalization rate going below 4%. That's crazy. Is that the hydroxychloroquine? I mean, that's really interesting.
I mean, I just think it shows the power of, people criticize their system, but you can never take away the innovation, ingenuity, and like just the work ethic of Americans, especially our medical system. We might have a lot of issues, but we do anything we do incredibly well. And I think we're the best in the world.
I totally agree with you. The other question I have is, have you seen the the Navy ship, the ship, the hospital out there.
No, I haven't seen the U.S. comfort. So, and just kind of give reference to your viewers. So we're right on the Hudson River. So, kind of where a little bit below where the Intrepid is, and kind of right by the Javits Center. But I don't know. I'm not really sure where this thing's going to dock. I would think the thing would dock kind of right by. I would put if I were doing it, I would probably put it in Midtown, just because kind of right where the cruise ships dock, because they're probably easiest port of entry. You have already ability for a large ship to be unloaded, offloaded. So if that's the case, you probably would see it come in from here.
You'd also, I'd say,
seen it.
You'd also want to put it somewhere prominent so people could feel the presence. You know what I mean? You want to reassure people.
Yeah, and right by the Intrepid, I think would be an unbelievable spot. That very clearly viewable, not too far away from Times Square. Kind of that's the heart of New York City, or some of the most symbolic. Now the other place you could see it is down towards Statue of Liberty. There's an area over there, but I'm not sure if a large ship can dock that, because this is a pretty large vessel or ship. So it's I would think it'd have to be somewhere around there. But it could be somewhere on the other side near Brooklyn, because you do have a lot of cases coming out of Brooklyn as well.
Right.
That might make more sense.
I'm wondering, is the population older in Brooklyn, at least in certain regions? I mean, like Greenpoint's a lot of old people, right? At least all the young people, I guess, have moved in and pushed all that out.
Yeah, I'm not sure. And the one thing I've also, and I don't know, maybe you could talk to this as well, is New York has a large, possibly because I've always, my thoughts, just because of the large Medicaid population here. And a lot of people just automatically, especially with the fear, people automatically go to the emergency room.
Right.
I don't know if that's the best course of action.
No, it's not. It is not. It's not. It's the worst.
And people feel like if they get scared that they have this, that they need to run to the emergency room. And most of the stuff they're most likely not going to get that. I mean, maybe they get more infected as well.
Right.
Which has stressed our emergency rooms as well. Kind of going with that. I'm not sure if anything with that going on. But
so let's
kind of my thought.
Let's kind of summarize things. So number one is, go to people are visiting the ERs excessively. They should be using telemedicine and going only when they have really extreme symptoms or a doctor instructed them to go. Because otherwise you're either going to expose other people or expose yourself to COVID if you don't have it. Number two, you're saying that you're concerned about people leaving their businesses and never coming back, right? This is like a terminal event, and that is a legitimate concern for the city, I'm sure. Number three, it sounds like things are getting better. Would that summarize it? Although it's awfully quiet, everyone is staying in place, and the hospitalization rate is down.
Strangely, I mean, look, if you look at the news, in some ways you'll hear it's getting better, but it's not. But I think it is getting a little better. I think people are getting more accustomed to lifestyle or what's going on here. I think from we have video chats with people, and people are getting stir crazy, but they also understand that. I think people are more conscious of the social distancing.
Yeah.
That makes more sense to them, and people are doing a better job at that.
Yeah.
Even, you spoke to the elevators earlier. In our building, people just wait for the next elevator now. I think people are very conscious of that and kind of keeping space with people.
Right.
As well. The same thing with deliveries. They're not coming up in the building. So it's there. It's just, there's, I guess the thing that scares me the most, kind of looking at this more from a financial perspective, is the cure. As the president, is the cure worse than the disease?
Right.
And that's what, at least my biggest fear with everything going on. But I from what I can see here, and again, we're only limited to really our apartment, kind of walking around. It seems like that. It doesn't. Maybe it does seem a little bit better than it was. The panic's not like it was maybe 4 or 5 days ago.
All right, Cam, stay in touch with us, and thanks for calling in and giving us a report.
Thanks for having me.
We'll see you on the other side of this.
Tell everybody who he is, because they want to know.
Cam Fruscia is he's our friend from New York City. He is Kat Timp's fiance now. I didn't know if that was official.
No.
Boyfriend. Boyfriend. Thank you, Susan. Cut that out of the stream. Well done, Susan. Well done.
Wait.
Oh my God.
I want you to be.
We have
fiance.
Well, that's Susan. That's Susan's plan for you, just so you know.
But we're actually having a cute little puppy come in tomorrow, so we're very excited for that. Yeah.
A puppy. Wait, you're not going to get a puppy, right?
Yeah, it's tomorrow. He's flying in.
What about the cat?
The cat's here. He'll be fine.
You're getting the cat a puppy?
Well, I'm getting us a puppy that the cat will enjoy too.
Oh gosh. Okay. Okay. All right. Well, good luck with that.
Thank you.
All right, Cam.
And also thank you for your service.
Oh, you're welcome.
Thank you. All right, Cam. Thanks.
Take care.
All
Bye.
right, bye. Cam, Army Ranger. That's what she's talking about. So he gave a lot, and he was a West Point graduate. So we appreciate his service. Here, let's get some of your questions on the restream. Why did nations shut down with the H1N1 of the SARS? That's a question people have been asking because that was 1 billion people and 500,000 deaths, mostly 40 to 60-year-olds, at least in the H1N1 case. And not as contagious, not as high a fatality rate overall, and not as likely to need hospitalization and supportive care like ICU. And prolonged ICU care is a major issue in this too, in terms of getting people in and out of these situations. The ARDS takes a while to resolve. Let's keep seeing what you guys want. Is it safe to donate blood? Please donate blood if you can, but make sure you assess your risk. You've got to be in a non-risk category and approach it the way you approach any other social environment. But yes, they need your blood donations. Do I think Easter will be enough time to slow down the virus? I have no doubt it's slowing down now. Although we're having a little uptick, and there's no doubt that the measures we're taking are working. The question is, how do you roll them back without causing another outbreak? And I don't have an answer to that. Should heart patients with arrhythmia be worried about hydroxychloroquine? Well, there's some data that suggests if you have a prolonged QT interval, you can get torsade. That's the main thing. That's the only real risk I've ever heard of with chloroquine, but I've prescribed it 1 million times and never seen anything like that. Do I think transit systems should still operate? I don't really have an opinion. I think people can make their own decisions about that, but practice social distancing. Do I think the antibody trials will be successful? Yeah, they probably will work. That's going to be another thing in our armamentarium. There's some evidence that that's looking good. That's a very expensive intervention and time-consuming. Let's see. Reuse masks. I talked to a mask expert, and he said that you can Lysol both sides and leave it out for 2 days and still reuse. So there is evidence amongst the experts that reusing masks is a good idea. Brian, I don't know what you're talking about with 25% fatality rate. You need to give me very, very specifics on that, exactly where you're quoting that. I talked to a guy yesterday, or was part of an interview yesterday, where a guy that was literally getting his last rites because of SARS, because of SARS coronavirus 2 or COVID-19, and started on the chloroquine program, and in 6 hours was improving significantly, like where he felt a lot better. So there's, again, anecdotes are out there. So yeah, I don't know what India is banning export of hydroxychloroquine. I don't know what that's all about. Maybe that's the generic that they're saving for themselves. Question about whether more testing has been done in this country than other countries. I will take the CDC at their word when they said that was true. However, we need to do a lot more. Do hospitals need volunteers? Some probably, but again, we don't want to put more people in harm's way. So only if they are really wanting you to do so. But this is the time to step up if you can. Sal's asking how we're all holding up. Susan, how are you holding up?
I'm good.
Somebody asked, New York has half the cases. Does this mean other states can lower their restrictions? That's the kind of question people are going to be asking next week. If they're staying low, how do we roll things back in areas that are not having an outbreak? It's a really good question. And here in Southern California, there's a region of roughly 30 million people, which is Riverside County, Orange County, San Bernardino County, Los Angeles County. And amongst all the counties, as of yesterday, we had about 800 cases. So in a region of 30 million, we had less than 1,000. And now let's say we aren't testing enough, and let's say a factor of 10 more out there. That would still be just 8,000 in a region of 30 million. Pretty good odds that you're going to be okay if you practice good CDC guidelines. In terms of how we're hanging in here, also, I've been starting to get depressed, so I feel like I need sunlight and exercise outside. I went and saw some patients this morning, and that helped me. So it's about having some sort of routine, light, and looking forward to the future, which is the hard part.
Do you see the question about the need to test for immunity and give us an immunity ID so we can get back to work?
Yeah, we are a million miles from that right now, but that is the kind of things I wonder if we're going to do. That'd be a great little plan. There's an immunity test that's a finger prick that takes 15 minutes that we could start to roll out all over the country.
But
And
where do you get it?
you can't get it now.
I want to get that.
It's not out yet.
I think I had it already.
I would like to get it too. I would like to get it. Yeah, people are starting to talk about their anxiety and things. Yes, mood disturbances, anxiety, panic, they are rampant right now. And we don't need that. The fact that people, continued. I finally saw a series of absolute highly qualified attacks on the Imperial College of London data that had been on the front page of the New York Times all week, which was the doomsday data that everyone kept quoting. Other epidemiological ecology systems came in and said, you are not considering all the actions we're taking, all the interventions. And they speculated that in the United Kingdom, there may be already as much as 50% immunity in the population. They were just using, again, models that may or may not be right. But of course, that's all speculative. But it's interesting that people are finally pushing back on that model that was so overstated and based on poor assumptions. Okay. Report in the UK seeing people who had flu shots are more likely to get it. That, never heard anything like that. Don't believe. Be very careful about what's flying around on the internet. I have heard of cases of people getting both influenza and COVID, and those are nasty cases. Non-flu vaccinated individuals, of course. Let's see.
Christine said, my dad says you're a pretty nice guy.
Okay, well, thanks, Christine. Chris, rather. Yeah, here's somebody who just almost broke down the grocery store today, just feeling the air about all this was so much. Yeah, I know. It's in the vapors. It's too much. Okay, New Jersey. You're at the end of a 14-day quarantine. Good. And the question is, did you have it? Leadership in Australia. Somebody in Australia. Oh, it's been sensationalized there too. Interesting. So she's complaining that the panic is out of control in Australia because of the what she's calling the Murdochocracy, Murdoch control of the media.
I made a mistake of reading the New York Times today.
Right. And did it upset you?
Yeah.
Yeah. What specifically?
It was just like every page, the headline was just so gloom and doom. And I was like, I didn't want to read the article. I was just like, wow, it's frightening. Maybe these things are really going on in the rest of the world. I'd prefer to not look at that. And I don't really trust the New York Times or the LA Times. So for other reasons, but it was just really hard to look at every page. I got basically to the back page and there was a couple of articles there that I would have been able to handle.
Somebody's saying, people are saying they like the Adam and Drew show today. I guess it's a break from all this. That's what that show is supposed to be. And how long will the pandemic last? We don't know, or know how it's going to play out. Is it going to be, multiple peaks coming forward? We just don't. There's no way to predict all that. But yeah. Why don't I host 12-step meetings? Because I'm not a recovering person. But we could host some. It's an interesting idea to host some kind of anxiety reduction something. It'd be interesting. Mindfulness. I don't know. Let me think about that.
Do you like a Zoom?
Yeah, Zoom. How many people can you put on Zoom? We only put 20 people in, but then can everybody else drop in on that?
Never really. I wonder if we could do it with our system.
Yeah, it's interesting.
I'll have to ask Caleb. We haven't figured it out yet. We're still having questions about that.
Kimiko Proctor, your numbers are correct as far as I know it, and you are not crazy for thinking we are doing very well. That's my point. In Southern California, we are doing very, very well. Okay. Susan, how long have we been going here?
30 minutes. I know.
Really? Only 30 minutes?
Like,
Seems like a long one.
Well, that's because you interviewed with Larry King. It's
Oh,
airing
yeah.
tomorrow, so
Yeah.
you had about a half hour with him.
Okay. Elevators are COVID-19 boxes, Joseph. Absolutely. I think when we look back at this thing, we've got to rethink the public health around elevators and around unventilated hallways. That, I'm convinced, is where, and there's some evidence that in this particular illness, the inoculum you're exposed to may have something to do with the intensity of the illness. And man, I could not imagine the inoculum you would get in one of those government buildings uptown in New York City in one of the elevators. I mean, it just seems like it'd be like somebody coughing into your mouth. I mean, it's ridiculous. So I don't know why more wasn't made of that before the outbreak. So that's interesting. Take the stairs if you can. Anna wants to know what I think about Governor Newsom's plan for California. I have no objection to it. If we collectively as a state want to go further than the CDC recommendations, so be it. It will work, and so far so good. We're in very good shape in Southern California. Let's see, hydroxychloroquine. Again, people are worried about that. Jessica's asking, what do you do if you're out of masks? You do not want to be exposed, right? You don't want to be in a situation where there is exposure, real exposure, where particularly droplets, which is the main means of transmission.
Bandana?
Yeah, bandana. I think a bandana is not a bad thing, mostly because it keeps your hands away from your face. And that, a barrier there to keep your hands out of your nose and mouth is not a bad thing.
But wash it.
Oh, sure. Does the virus have long-lasting effects after you have it? It depends what kind of complications you have or not have. If you are just getting the flu type syndrome, no.
We have a lot of international people here today. So
yeah, Adam of Angels asked about the Oxford model. That's what I was talking about earlier, where they were attacking the Oxford group. We're talking about the University of Oxford in England, Oxford University in England, and they were attacking the doomsday scenario, and they were pointing out that in their models there was a lot of immunity already in the United Kingdom. Should you wear a mask at the grocery store? Not necessarily. Just keep social distancing. The mask should be worn by people doing the checkout, though. I mean, think about it. They're doing hundreds of people walk by them every day. That's something I think they should wear masks. Okay, last week I stated 20,000 by Monday. We're in good shape. No, I said 30,000 by Monday, and I said, no. I said 30,000 by Friday, and I said 60,000 by, no, I beg your pardon. I think I said 30,000 by Monday, but I said 60,000 by this Friday, and we have surpassed that here on Wednesday. So it looks like we're going to be more towards 90,000, 90,000. It depends on the rate of increase. If the rate of increase, a lot of this was backlog testing still and more widespread testing. But if we have a rate of increase that sort of doesn't accelerate, again, we're in pretty good shape. And 60% of all of this is coming out of New York City. You got to remember that. Most of the country is not experiencing what New York City is experiencing.
That's why we were talking to Cam.
Here's somebody mentioning people losing their taste and smell. I've seen that for many viruses. I'm not sure that's just unique to this one, but I have heard that.
That's why I think I got it, because I couldn't eat regular food.
And we don't know if it's transient or not. So that's the other thing, is like permanent.
It's like when you get the flu and you can't smell or taste.
Can you tell us if persons can ride their bike outside? Yeah, I'm going to go running after this. You can do all kinds of outside activities. The idea, though, is we don't want you congregating outside. That's why the beaches and the parks are being closed. So you can walk in the street.
Can't you go to the park and stay away from people, though?
I suppose you can, but there were people congregating. That's the problem.
Oh.
Can dogs get it or pass it? They get it on their coat and can pass it that way. In terms of them getting the illness, I don't believe so.
But only if you're really sick. You can pass it.
What, to dogs?
Like you'd have to really have it sneeze on your hand and kiss your dog and rub your dog.
Yeah.
And somebody else would touch the dog.
Yeah.
I mean, it's not going to happen. Like the dog's not just going to get it.
Hey, Jewish Thornton, are you in Arkansas? And if you are, have you seen Tom Segura's new special? He goes after Arkansanians a little bit. Kind of funny. Does the amount of viral load you get at initial exposure correlate to the severity of illness? That's S. Flanagan. People are saying that. I haven't proven that, but there is some evidence, there's some sense that is the case. So that's why things like elevators concern me.
Somebody wants to know if New York should close their borders.
New York State?
No, New York. Yeah, New York.
Or maybe should make, well, it's an interesting question. I mean, they surrounded New Rochelle with the National Guard. If that logic worked, if that helped, why wouldn't they just expand that cordon of entry to the whole island? I don't know.
Or
one of the
flights
concerns
in and
is,
out.
well, one of the concerns is people are fleeing New York City, which I think is a good idea in terms of reducing the density of transmission. But a lot of them are already infected, and so they're seeing, as they move across the country, you're seeing all these outbreaks where they're essentially like Europeans seeding our country now. So
Apparently our building's very quiet.
I bet. I think people have gone away.
I know.
A bunch went to Florida. That is true. That is true. Kelly says that. Yes, Kelly, you're absolutely right about that. Let me look here. Vitamin D, selenium, zinc all help the immune system. Well, vitamin D has been advocated. Vitamin C has been advocated. Zinc has been advocated. And again, it's hard to know what doses. And selenium I've not heard. But okay, I'll take your word for it. Also, hormesis. You should be taking, if you don't have any medical risk, you should be taking cold showers. Cold showers sort of shock your immune system into action through something called hormesis. Mrs. Pinsky has been explicit that she will not do such a thing.
I like hot showers.
It is the Adam Carolla method, ice bath. I did it this morning. It is interesting.
Of course you did.
Yeah. Well, I'm trying to do what I can.
I took a hot shower. Felt really good. I'm such an infidel. I'm sorry.
What about melatonin? That's more sleep-inducing. It's chronotrope. I know myself, it helps me fall asleep like crazy. Azithromycin, the French talk about it. That's correct. And they use it with hydroxychloroquine.
I love that stuff.
Extreme benefits are being reported. Again, you have to have the data that proves that. We're in the madness of crowds right now. I recommend a book for everybody called Extraordinary Popular Delusions and the Madness of Crowds. And part of the madness of crowds is we will swing from one direction to the next. We'll run, we'll run in one direction because we think we see an answer there. And then if it doesn't pan out, we'll run in the other direction. And so the question is, are physicians succumbing to the madness of crowds? It may be. We're people like anybody else, and it may be wishful thinking. So until we have the science, that's why Dr. Fauci keeps saying, he's a scientist, he's got to see the science, and that's his job.
What's the name of the book?
Extraordinary Popular Delusions and the Madness of Crowds. Are you buying it now? Or are you just putting it on the... Oh, I believe it's in our library downstairs here.
I don't want to read it.
Oh.
I'm just suggesting it.
Okay. It's all about the different...
I'm learning firsthand here. I'm good.
Madness of Crowds, that book is about the tulip crisis. It's about the French Revolution. It's about mesmerism. It's about all kinds of other crazy outbreaks we've had. Wouldn't it help if more people wore masks in public? I don't know what the pros and cons of that are. I would say just listen to the CDC. Do what they tell you. Do I think this is Sawzell? This will impact less dense areas. It will impact you, but not the way it does dense areas. Everyone's pretty clear about that. Can allergies and anxiety make you feel like you can't breathe? Absolutely. That's one of the fears that people will get. A lot of what they're seeing in the emergency rooms are panic attacks, in fact.
Oh, that's terrible.
Yeah, Katie, I've been talking about the hydroxychloroquine ban. I don't understand it. I don't understand it. Elderberry, no, there's no evidence of that doing much of anything, but you certainly at your liberty to take that kind of stuff.
Yeah, makes you healthy. It might have some vitamin C in it.
If you self-quarantine for 14 days and no symptoms, is that a guarantee you don't have the virus? It's a pretty good evidence. Well, I mean, it's not a guarantee. It's a high probability that you did not get infected. There are two other possibilities. There have been people that have developed infection out at 21 to even 27 days out.
Really?
But that's rare. Or you could be an asymptomatic carrier, and that's also, again, we don't know the percentage of that.
Drew, how are your patients doing today?
Really good.
Because, I mean, they're all elderly, right?
Some were. Actually, really good. And everyone had a very positive attitude. I think it's a relief to go out and interact with people. No one had any symptoms. There was one elderly woman, particularly her daughter, who were just very yeah, the virus is out there, so we're going to pay it. We're going to be careful. It's that virus, they're just like, they were not, it didn't have the mythical quality of COVID-19 that we've given it. They're just like, yeah, there's a virus afoot, and we're going to pay attention, and we're going to make sure she didn't get it.
Well, you're dealing with the world. They're just dealing with Pasadena.
Yeah, and I thought that's a good way to look at it. It's just like, we're gonna look
How old was the elderly mother?
68.
Oh.
But many underlying conditions that put her at significant risk. So I just thought there was a realism about it that I appreciated. That's all.
Somebody wants to know why you don't care about Robert Paul Champagne.
Your Mom's House team, I specifically was talking to Christina P. and Tom Segura last night. We are trying to reach him. He's mad at me, so it's not clear he would respond to me, but he does respond to them. So they are reaching out to him. Let me find out right now. That's all right.
Well, maybe he doesn't want to be bothered.
Well, let me see.
He doesn't want to be made fun of in time like this.
The streaming world I'm speaking to is wondering how Robert Paul Champagne is doing, ? Did you make contact, ? So let's see what Christina P. says. All right. See what she says.
He's been posting on Instagram.
He has been?
Yeah. So he's
good.
alive.
He's good. All right, good. That building to me is the poster child for transmission of yeah.
I wonder if he's cleaned his house. You know what I mean? Like, I cleaned everything.
Yeah.
We've been cleaning corners of the house that we
Let me just say, you would not be visiting soon.
No, I'm not visiting.
I'm just saying, whatever he's cleaning, he's doing, you would not be.
No, I have no interest at all. Thank you.
Yeah. Let's see.
But I am concerned about his health and well-being.
Kidney problems of coronavirus. I think what you're hearing is about the effects of prolonged infection and shock, and that can always affect the kidneys. Hope Dr. Fauci's on top of the spread. Yep. Any way to track deaths from this back to December?
He said today that most of the people that were passing from it were elderly. So
did he say that, or did
he said that? I heard him today.
Yeah,
I heard like 3 minutes, and then I was out.
Cuomo made a big deal about that yesterday. He said, I think I heard him correctly.
Again?
He said that less than 1% were not at risk,
right?
Not a specific risk category. Our mayor made a point of saying everyone can get it, everyone can die, and that was just that was not good, because the case he was talking about was a 19-year-old with lots of confounding variables.
Exactly.
So.
No, but I know that Cuomo said that a lot will get it and very few will die, and then today Fauci said that it was mostly the elderly that were passing, or 100%, like 1% or whatever.
Christina's not answering me, guys. So she must not care about Robert Paul.
I mean, we want to keep everybody alive as long as we can. It's just, everybody and people that are at risk should be very careful.
Somebody's pointing out that Robert Paul's Champagne immune system would be pretty hardy. I think you have a point there.
He's got the Adam Carolla,
Is the curve flattening? It's maybe flattening in some areas, not in others. In New York, clearly it's still accelerating, and so that's the question: how do we make decisions about local epidemiology? And that's a harder issue. Remdesivir is being studied, and I've heard some very good reports about that. And then somebody asked, what was the question? It was a good one, I thought. Oh, somebody said Fauci has been silenced at the press conferences. Absolutely not. He has been very outspoken yesterday and today.
I mean,
listen to him. Oh, you did? Wasn't it him?
I think it was him today.
Well, yesterday he gave a very, very good briefing, so okay. I'm assuming he's at it again today. All right.
But he did kind of go on and on and on about the same subject for a while, and it was
that's him. Okay. That is him. So that meant that's probably Dr. Fauci.
I got it. We got it.
Yeah, Bernie's at the age where everyone needs to protect him. That's absolutely true. That was the first. At the very beginning of this outbreak, I was saying, I'm not sure you need to isolate from crowds yet. I think the CDC is not saying do that. But I said there shouldn't be democratic debate, because those two need to be away from everybody and self-quarantine.
Oh, God.
Which is what they did. That's what they did.
Do you think they'll postpone the election?
No, I don't. The reason I don't think they will is there's precedent. We had an on-time election during the Civil War. That's how important those elections are felt to be. This is not the kind of disruption that the Civil War was. So let's assume we're going to make it to the election this year. And by the way, and my understanding is the Constitution. Now, please, I'm not a constitutional person, but I was schooled that if you miss the election, that the president doesn't stay president. He has to hand down to, like, there's some chain of command. So it's a very weird thing. So I'm sure that there will be an election. Is a pneumonia shot helpful? Not for this, but it's helpful for pneumococcal pneumonia. And there's two different ones, right? There's the polyvalent pneumococcal vaccine and there's the Prevnar. Both need to be taken. Talk to your doctors about that.
Shingles too, if you're 60.
Shingles if you're over 60. Shingles, the new shingles vaccine. Okay. How do I feel about the Olympics getting postponed? I think that's prudent, but the question is how long.
Well,
that's, again, a difficult call.
The Olympians can't really train right now, so it kind of screws everything up, right?
Yep. Yeah, I don't know how they would possibly do it. I mean, my goodness.
Plus, just organizing Olympics.
And think of people from all over the world. Well, I suppose you could.
And they closed all the hotels.
I suppose you could test everybody that goes to the Olympics, something like that.
Where are they going to put them if all the hotels go out of business? They can't do anything until they know.
Okay, here's something that is a misconception. Brian says, I've never been sick, nor had the flu since I was 11 or 12, never had any health issues ever. Does that mean I'm at low risk? It means you're at low risk for complication, but it doesn't say anything about the probability of you getting flu or coronavirus. You're a healthy person, so you'll probably do well with it, but people never get sick until they get sick. I can't tell you how often somebody comes in my office and says, what? I've never been sick before. That's correct. You're never sick until you are. And that's the way most people relationship with the environment is. We don't get sick until we do. And then when we do, it's on. So don't think because you haven't been sick, you won't get sick. We all get sick in some fashion at some time. Okay. Still nothing from Christina on Robert Paul. So
maybe she's taping.
Maybe.
Or taking care of her children.
Could be.
Taking a nap. I don't know. That's what I want to do next.
Interesting question. Had a kidney transplant, but 100% match, so didn't need to be. Would you have a monozygotic twin or something? 100% match, so you didn't have to take immunosuppressives. And are you at risk? That's an interesting question. I don't know the answer to that. I would. You're not a perfect risk, that's for sure. Eczema higher risk? I would say not, provided it's like routine eczema, not where your skin is bleeding and you're open to the outside world, and you're not on immunosuppressives for it. How is Pennsylvania looking? Somebody wants to know. Well, let's go to COVID tracking and see how Pennsylvania is.
We should have a map that pops up on the screen. If I could do that. I don't know how to do that though.
Has 1,100 documented cases, 11 deaths in an entire state. I would say that's pretty good. Let's again give you a factor of 5, 10 more times more than that out there.
Yeah.
Still 10,000 in a state the size of Pennsylvania. I would say that's doing pretty darn good. Now, could it spread? Yes, it can. We of course know that. We've seen it. So we have to be very careful. The question always is, do we need to practice more than the CDC guidelines? And that's the harder call. And if you do practice those guidelines, how do you roll them back when it comes time to go back to work? So
somebody wants to know when the next Dr. Drew After Dark with Christina P is. And I will probably drop tomorrow in podcast form. Find it where you listen to your podcast and YouTube on Friday.
And also, I'm going to be on the one she does with Leanne Kreischer. I'm going to do that one with her too.
Oh, nice.
Yeah. How about Texas? Somebody wants to know. Well, let me see about Texas. I heard Texas was doing very well, but I've not looked at the numbers, so let's look it up.
How is everybody over there at After Dark? Are they all healthy?
They're doing well. Texas, an entire giant state of Texas, 974 cases, 12 deaths. So let's again multiply that times 10, or let's see, do it by 20, because Texas has not been doing great testing. Still very, very few cases for a state the size of Texas, but be diligent, prevent spread. Good. The total in the country, according to this website, is 60,000. We're a couple days ahead of schedule for me, most in terms of what I was anticipating for the country, and most of it is coming out of New York City. 60% is coming out of New York City.
That's
so
crazy.
That's where the problem is. I'm guessing there will be another urban hotspot somewhere. Boston, Baltimore.
Yeah, Boston.
Baltimore,
probably.
maybe. I'm worried about them. Let's look at Maryland. Let's look them up. So, it's where you think the outbreaks are going to be, where they've always traditionally
How
been.
come not Chicago?
Maybe Chicago. Let's look. Illinois has been having a little.
Chicago is like.
It's a good point. Illinois has 1,500 cases.
That's not that much.
Yeah, and it doesn't say how much of it's coming out of.
Well, they depend on cars more too. Like I think where you have more of the subways and taxis.
They have a lot of subways there.
Yeah, but I mean, a lot of people have cars there. I've
In
noticed.
LA County right now, 662 cases, 11 deaths. We are doing very, very well here so far. So far, so good. Well, okay, so why don't we wrap everything up here? I'll be on
Thanks
Fox
everybody
11
for
tonight.
watching.
Thank you to
We're
Cam.
gonna play an ad for Hydrolite. We're playing our ads at the end and Blue Mics. If you could, learn more about it, we really
Yeah,
appreciate
our friends. This is the
sponsors.
hydration product you want to have on hand if you get sick. Like, stay hydrated, everybody. And if you're out exercising, make sure you stay hydrated because you can predispose to problems.
And we want to thank Blue Mics for the mics. And
Blue Mike
also
and our
the-
friends at the Sand Mini. This is still important. The homeless are still out there using needles, and this destroys needles. Everybody, if you're a diabetic or someone that's using
How
needles,
are
you drop
those
it in there, it
homeless
melts.
people, Drew, how are they?
I have footage that Alex Datig sent me yesterday. She went downtown and took footage in Skid Row, and it is exactly the same as it always been.
Yeah.
Nothing has changed.
Yeah.
And I said on the radio and television yesterday, that is a powder keg that is waiting to explode. That is a grave concern. So they got to do something about that. They must do something, and not doing it, allowing it. They're congregating. They're smoking meth together. It is bad news. So that is not going to go well.
I'm sure they're not watching the news.
Yep. Let's see if there's anything else.
Somebody said you're not a real doctor. He is a real doctor, okay?
Well, let me just give my data. So,
God.
medical school in 84, residency 87, chief residency in 88, and then double board certified in internal medicine and addiction medicine, and then have assistant clinical professorships in psychiatry, pediatric adolescent, and internal medicine.
And he went to the office
So-
today. He must not have been here during that part.
Right.
I don't know. We still keep that office open.
Yep.
It's not a moneymaker, trust me.
Yeah.
It's a public service.
Let's see here. Anything else you guys are wondering about? Yes, thousands of people take the public transportation. I take it when I'm in Chicago. The CTA, I think you call it there in Chicago. So it's a good system. It's a good system.
Somebody said you were their first detox doctor.
Oh, you doing okay now?
Lindsay.
Lindsay, you doing okay?
She's got a little blushy face.
Lindsay, you doing okay?
I hope so. Stay well.
At Las Encinas, sure. Actually, I remember your name. I can't quite put a picture to you, Lindsay, but I hope you're doing okay.
Lindsay's well.
Good.
Her name is Lindsay Well.
Okay.
Let's hope.
It works if you work it, and it's hard right now. Are you finding meetings online, or what are you doing? Curious to know.
Yeah, if you guys know about more online meetings, we should post
Good.
them here.
Lindsay's doing good. Thanks, Lindsay. Good. Thank you for the feedback.
Congratulations.
Okay. I'm just looking back through the scroll here if there's anything for you guys. Hold on.
I know soberaf.com has links to meetings online and stuff. They actually called and thanked me for mentioning it.
Yeah. Also, oh gosh, there's a bunch of them that are organizing meetings online. Somebody says in Brooklyn and depressed. I get you. I get it. It's hard to be locked in. It's hard not to know the future. Those are not comfortable things for human beings. And I think we need to have a road ahead. I think the road ahead is something at least to look forward to. And how they do it, I don't know, but that's going to be a tough putt. Justin, you want to call Adam Carolla? Isn't that podcast up, Susan?
Adam was on the show on Ask Dr. Drew last Sunday. So if you go to YouTube or Facebook or Periscope, you can see the show there. And we'll have it up in podcast form this week. He was just on.
And you always go to the
And
Adam.
Steve-O. Steve-O was on as
And you can
well.
always go to the Adam and Drew show if you
We
want.
should have Steve-O back soon.
Okay. All right, let me get back to you guys. Scroll here one more second.
Sorry.
Is anyone else worried the fact that the receptors the virus attached to exist in the testicles? Well, listen, those receptors exist in lots of places, and there's been a lot of study on it, particularly as it pertains to blood pressure medication. And these are not issues.
You mean in the testicles? Like in
That's
the
what he's
semen?
saying. I don't know that that's true.
Or
but,
on the testicles.
Would I be impressed how AA districts are supporting local groups to reach newcomers and people who have not yet found AA? I hope so. I'd love to hear that. I've got lots of friends in the program that are working hard to keep the outreach going.
Are you going to be on Fox tonight?
Fox 11, yeah, with Dr. Oz tonight.
Yes.
Oh, they want Theo Vaughn on, so we'll get maybe Theo back.
Oh, I wonder how Theo is.
He is obsessed with the Tiger King. Because every single
Wait,
one.
when did he tell you this?
I know this because every single one of his Instagram posts has been his face superimposed
I'm going to text him right now and
on the Tiger King's face.
I'm going to tell him that people want to know how he's doing.
He could drop in on one of these streams. How would a husband have COVID but not the wife? This is the point. It's not that easy to get this disease. There's lots of cases like that people have prolonged contact, intimate contact, and not getting it. So that is an interesting phenomenon that people are studying. Is it in the air? Does it linger? It's in the air, but it doesn't linger. I worry about it lingering in like an elevator or a hallway, but not outside when you're running. Does the media still say, why does the media still say millions will die? I don't know. That is to me, that's irresponsible. It's really, really hurting people.
Theo Vaughn was a good idea. He's been too busy to do anything with us.
Well, he's not traveling now, so
over the years, and I'll have to see if I can.
Do we have idea of the mortality rate of coronavirus? It's way down in New York City, below 1%. Overall, the mortality rate in this country has been much better than Italy, certainly, for various reasons. Again, the innovative and the responsiveness and the innovativeness of our healthcare system is second to none. And we are not predominantly old the way they were in Italy, and that got them hit pretty hard. Where will we be at in a week? Okay. I'm not ready to make that prediction yet. I got to see where we are. I want to see where we are next Monday.
I don't think it's your choice, Drew.
To make a prediction?
Nobody knows. Yeah.
I've been pretty close. I've been pretty close.
No, don't. Because if you predict something, go, you said that it was going to be here and it's been here, and why did you do that? So just don't even predict.
Well, I'm saying...
Don't take the risk.
I'm saying that somebody needs to speak up and talk about what numbers do we need to worry, what numbers do we need to feel pretty good about. And what I was saying that if we're around 60,000 by this Friday, we should feel pretty good.
Let's leave it up to Cuomo.
The reason I'm wondering about next Monday is by then we should have the data on the hydroxychloroquine. And so we'll be interpreting the data in the context of rates of change and hydroxychloroquine. And so we'll be better able by next Monday to really give you more information about where we are.
I want it to be sooner than later.
What?
I'm just hardcore. Let's just go for it. But
you want to get sick?
I don't care. I think I already had it.
What if you haven't?
I'd prefer to just die and not lose the rest of my life waiting.
Somebody's asking, are we seeing COVID-19 virus with diarrhea and shivering and chills? Yes, that's a common presentation. GI, fever, chills. So if you start coughing, that pretty much is the trifecta. So keep an eye on yourself. Call your doctor. Get tested. They probably won't test you at this point, but get somebody watching you.
Somebody's mad at me because I told you not to make the prediction. If you want to make the prediction, go ahead. But
no, I'm not going to make the prediction because I was saying I want to wait till Monday. But but I will say something on Monday about where we are.
Because a lot of people think you know everything and you know when it's going to end, and they've been asking for.
I wish I could say that. I wish I could say when it's going to end. But I can things like I can say things like that Easter date. Not so unrealistic for some rollbacks from some people coming back to work. Before that, we'll see. I mean, it'd be nice if some people can get back to work in certain regions. So we'll see.
I mean, what different? Never mind.
All right, we'll check it out. Thank you all for being here.
It's so frustrating to me. I'm sorry.
Frustrating.
I'm a layperson. I don't like it at all. So
you're frustrated that
we don't have an idea of when people will be able to go back to work and put food on the table.
To be fair, if we had more testing, we could, I'd be more comfortable talking about rolling things back to work. And if we get antibody testing, if we just sort of knew more where we were in the community, it'd be an easier thing to talk about.
Esmeralda, it's okay. Don't worry. It's just a discussion.
What'd she say?
I'm not taking it personally. When people tell me not to talk, it just makes me want to talk more. So don't worry. It's fine.
Boy. What does that tell you about Susan Pinsky's personality?
Yeah, they said don't stifle the man because they want to know what your prediction is. So
my prediction is I'll have more to say on Monday.
Okay.
And that if we're around 60,000 on Friday still, that's pretty good. And remember, again, 60% of cases coming out of New York City, pretty, the rest of the country, pretty good. Pretty good. Susan, they say you're soothing. Denise says you're soothing.
Oh, thank you.
See?
I have my fans, what can I say?
You want links to the coronaviruses I use in terms of data. I use what most people are using, which is the Johns Hopkins Coronavirus Resource Center. And I use the LA County Department of Public Health. And then I use I have to look this one up, of course. Shoot, I'm not going to be able to get it for you. It's like the COVID Resource Center or COVID Data Resource Center or something. And I unfortunately closed that window. Oh, COVID Tracking Project. COVID Tracking Project. So COVID Tracking Project is a very good website for the United States. So, okay, so let's kind of wrap things up. Can we do that?
Okay, I'm going to run a couple of ads at the end, and hopefully you guys will enjoy those. Also, we'll be back probably tomorrow.
All right, good. Hopefully I can see you all tomorrow. For some reason, I'm on FaceTime, too. Let's get rid of that.
Who are you on FaceTime with?
Nobody. My FaceTime just popped up.
Oh.
And news popped up.
Okay, and also tonight, check them out on Fox 11, 7 p.m. Pacific Standard Time, also 10 p.m. in New York. And you can also find the feed at facebook.com/Dr. Drew in its entirety if they don't have any problems. I think they're short on staff over there, and the feed on Facebook cut out 3 times. So if, just be patient, go back to, the link, and you should be able to find it also on Fox LA.
Somebody's asking also for a report on the Canadian situation. Again, go to the COVID Resource Center, COVID Tracking Project, and see what's going on in Canada there. I think they have, of course, I can't call it up for you. I'm sorry.
What's the website?
You know what? That looks like just US. So the other website is Worldometer. Worldometer. It's not a great site, but it's worldometer.info. And you can get information about Canada. Let me look it up really quickly before I go. Coronavirus updates. Countries. I'm going to give you a little Canada report in one quick second. Canada has 3,300 cases, 30 deaths. That's pretty good. The country the size of Canada. I don't know where they're concentrated, though. Let me see if I can get any information about the regions. You're on an upswing.
Drew is a real doctor, not just.
You're on an upswing. Your new cases are clearly accelerating. So you're in the midst of the uptick. The question is how long and how bad. Right. Give me 1 second to see if I can find a regional thing for you guys. No, can't get it. All right. So thank you very much, and we'll see you tomorrow.
Okay. Bye, everyone.
Bye. We've all been very focused on how to stay healthy these days, but we've not been talking about hydration. If you get coronavirus, flu, or even experience allergies, cold, a variety of everyday ailments, they all need hydration. And that's why it's a perfect time to welcome our friends at Hydrolyte back. This is a great product. You all know I've talked about it for a long time. This was the hydration product I wanted to invent, and they got it there before me. Now, remember, dehydration can make you feel sick, even a slight amount, and none of us need that anxiety right now, so stay well hydrated. I am thrilled to welcome our good friends at Hydrolyte back to the show. Longtime fans remember my obsession with Hydrolyte, which is literally the best hydration product I have found. I'm even more excited to introduce their brand new single-serve powder sticks. Simply pour 1 powder stick into a glass of water. They recommend 7 ounces. The powder dissolves instantly and creates the perfect balance of sodium, glucose, and water to deliver up to 4 times the electrolytes of your typical sports drink. And think about it. You can take this anywhere. You should have it on hand to just pour it into water and you have a real significant hydration product. The other great news about Hydrolyte, the powder sticks, they are 100% natural, no artificial flavors, colors, or sweeteners, and they are available in flavors like orange and lemonade, and they taste great. Hydration is crucial. Hydrolyte is the fastest and easiest way to stay ahead of it. And you can find Hydrolyte powder sticks in the digestive aisle at Walgreens or Amazon, or simply just go to my website, drdrew.com/Hydrolyte. Again, that is drdrew.com/HYDRALYTE. You see it spelled here. There it is. And you enter the code DrDrew18 to save 30% off your order. Forget the runs on toilet paper. There should be runs on this. This is doing much more for your health than toilet paper. So go get some. Have it on hand. If anybody in your family gets sick, you need to keep them hydrated, and that's how you do it. Needles have increasingly become a part of everyday life. Proper disposal is both difficult and expensive. We have the solution. Simpler, safer, affordable, and fulfills the obligation to protect our environment. A single stick with something like this means tracking down the user. It means blood test for the person stuck. It means possibly medication for an extended period of time. Needle sticks are devastating. No more. Incinerate the needle. Needle goes in this port. It's over. Done. Needle gone. We all have loved ones who use needles. Keep their home safe. Medical offices are loaded with sharps. We are using ancient technology to protect our patients, our staff, ourselves. You know what needle sticks do. You know the cost and the devastation psychologically and physically, potentially, from a needle stick. Eliminate that completely. Stop using ancient technology. Sand MIDI. It will solve your problems. Find out more at needledestructiondevice.com. I am so grateful for our friends at Blue Microphones. Not only have they completely changed what our show sounds like, they've given me headphones so I can monitor things better. This is the mic for millions of creative people, and now I know why. I'm so grateful for them completely changing the quality of our audio. You'll find Blue mics like Yeti and the Mouse, which we're using here, both in pro studios and home studios, literally all over the world. Their popular Yeti caster is a Blue Yeti microphone, plus a boom arm system that's behind many of your favorite podcasts. I run into them all the time, and now I know why. If you've ever thought about creating your own podcast or YouTube channel, Blue can make you sound and look great. Just visit bluemic.com and click Get Started, and you can start telling your story.